Hello students. Students, today we would discuss about the anal canal. Students, we would discuss anal canal in a such way the points that would cover the practical aspect, clinical aspects and some theoretical aspect. In the Unani terminology, the anal canal is called as the method. Anal canal is a terminal part of the gastrointestinal tract and it is around 4 centimeter. The average length of anal canal is around 2.5 to 4 centimeter. It is a terminal part of the gastrointestinal tract. It begins from the anorectal junction and it ends at the anal verge. Anal canal is a hollow structure, canal-like structure, but it is different from the rectum. It is angulated with the rectum. It is angulated, and this angulation is produced by the puborectalis muscle, and that is found at the level of the anorectal junction, and that actually bends the anal canal as compared to the rectum. The points that are of practical importance for the anal canal, we have to just distinguish it from the rectum and other part of the gastrointestinal tract such as large intestine. The differentiation between the anal canal and the rectum that you can make, the anal canal appears to be having cushions like structure, and we call it the anal cushions. The anal cushions are protruding cushions like structure that are found in the interior of the anal canal, especially at the upper half aspect of the anal canal. And this is very specific to the anal canal and anal because that produces the normal physiological hemorrhoids, and that anal cushions are important for giving the anal canal a continence for the fetus of flatus and the fluids. So it holds the fecal matter, otherwise the fecal matter would inadvertently come out from the anal opening. So it is very important for the continence of the fecal matter and the flatus, otherwise we would not aware of the passing of the flatus and the passing of the fluid if these anal cushions are not producing its effects. It actually gives the competence. It actually gives it actually makes a seal to the interior, so the fecal matter and the flatus cannot pass easily. And whenever the we desire to just make it out from our body, then we can actually push it. This is the anal canal, and you can see in this model, and that shows the anal canal at the terminal part of the gastrointestinal tract. As far as the interior of the anal canal is concerned, anal canal can be divided into upper half and the lower half. The upper half is basically that is the interior of the upper half is lined by the columnar epithelium, and this columnar epithelium that is secretory and absorptive in nature, while the lower half of the anal canal that is very pain sensitive, and it is lined by the stratified non-keratinizing, especially in the upper aspect of the lower half of the anal canal. It is non-keratinizing. It is made up of stratified squamous epithelium. It is tough and it's very pain sensitive, and whenever the pathology such as fissures and the hemorrhoid that develops in the lower half of the anal canal, that is very painful. And the anal canal is also a site for the portosystemic anastomosis. where whenever there is a um, obstruction in the portal circulation, and then this site, the portocable anastomosis site in the anal canal, that can be having bulge. The vein, the blood vessels may bulge out because the blood is not draining to the liver and to the inferior vena cava, because there is a blockage anywhere in the portal system. This is also a site for the portosystemic anastomosis, and it is also a site for the various anal pathologies such as hemorrhoids, fissures, and fistula in ano. These are the things. Anal, the upper aspect of the anal canal, as I have told you, it is columnar in type, it is secretory absorptive, and it has the interior lining it has 8 to 10 vertical folds, and we call it the anal column. And the lower, the terminal end of the anal columns, actually they have semicircular uh, flap like structure. We call it the anal walls, and anal wall that is important for the pathogenesis of the fistula in ano and the anal abscess, because there is an infection of the anal glands that has opening in the anal valves also. Because the anal valves are the semicircular flap-like structure that is situated at the lower end of the anal column, that is produced subepithelial that is produced by the subepithelial connective tissues, blood vessels, and other things that actually make it very prominent, and it appears to be column in shape, column like, and it is around 8 to 10 in numbers, and they are found around the whole circumference of the anal canal, especially in the upper and the middle aspect of the anal canal. The, the end of the lower end of the um, these anal columns, they have flap like semicircular uh, flap like structure. We call it the anal valves, and between the anal valves there is also a space inside it, and we call it the anal sinuses. Anal sinuses is also a space that is found between the two anal walls. When two anal walls actually they meet together, and the potential space that is found inside it, below it, and we call it the anal sinuses. Anal sinuses along with anal valves, they actually make the circular line like pattern, and we call it the dentate line or pectinate line. This dentate line and the pectinate line, that is very important, because this is the site and the transitional part where the mucosa changes from the one type to the another type, and this is very important, and you can actually appreciate this type of transition. That is it is also called the line of Hilton, actually. This dentate line or pectinate line, that is a boundary between the upper half of the anal canal and the lower half of the anal canal. The lower half of the anal canal, that is very pain sensitive, and it is squamous in nature, while the upper half of the anal canal, that is secretive in nature, and it is made up of columnar epithelium, and it has a lot of mucus glands are there, globular glands are there, and that produces the mucus, while the lower half is devoid of um, such type of structure, and it is very pain sensitive. There are no hair follicles, uh, no mucus producing cells, but they and this lower half of the anal canal, it is having the innervations of the nerve endings, somatic nerve ending, that actually make it very painful whenever the pathology arises from it. If you see the interior of the anal canal, so you would appreciate the bulges that appears to be inside the interior of the anal canal as the anal cushions, and these are the normal internal hemorrhoids actually. And if it becomes pathological, it is increased in size, then it becomes pathological. Otherwise the hemorrhoids are normal, until or unless it becomes so big, it actually creates problem when it bleeds, and when it protrudes out, then it is abnormal. Otherwise it is a normal anatomical structure, and that is very important for the continence, for and actually it makes the seal for the fecal matter and other gases such as flatus. It actually keep it from passing out. Otherwise we would have fecal matter that is coming out and the flatus that is coming out inadvertently and without conscious knowing that something is going out, until or unless this anal cushions don't work of its own. So these are the importance of the anal cushions. Mm, and these anal cushions that lie in three position mostly, and that is called as the primary hemorrhoidal positions, and one position is basically that is and this hemorrhoidal cushions, anal cushions, that is actually produced by the subepithelial structure, subepithelial structure, and that is having the smooth cells, sinusoids, and um, veins and artery. It is not just only the dilatation and the engorgement of artery and the veins. It has connective tissues. It has smooth muscles and sinusoids. The combination of these structure inside the subepithelial level, that actually make it the anal cushion. We have learnt about the anal valves, anal sinuses, and anal glands are there, and anal glands are important because it produces the mucus and secretions to the anal canal, and sometimes it gets infected, and that produces the anal abscess or anal sepsis. uh, that is important, and this anal abscess that may cause um, fistula in ano, and other and from and any sepsis or abscess, actually it can go to the other anal spaces, such as rectoanal foci. Actually this infection may spread out to the rectoanal foci. These are the spaces that are found laterally around the anal canal, especially the posterior and lateral aspect of the anal canal, and in the pelvis. The infection from the anal area, that can go to the anorectal foci actually. The part of the anal canal that is below the pectinate line or dentate line, and we call it the pectin, and we also call it the anoderm, and you can actually differentiate because it is shiny and it is smooth as compared to the upper half. And the anal canal is also surrounded by the two sphincters also, internal anal sphincter and the external anal sphincter. Internal anal sphincter and external anal sphincter is both, they compress the anal canal, so it remains closed most of the time, unless or until the fecal matter and the flatus passes through it. especially the fecal matter passes through it, and then it relaxes, and then it actually permit the fecal matter to pass through it. Otherwise it actually maintains the anal canal to get closed. That this is the job of the anal sphincter, that actually make the anal canal closed most of the time, until or unless we actually uh, passes out the fecal matter. There are two type of the anal sphincter. One is the internal anal sphincter. Internal anal sphincter is just a it is made up of the smooth circular muscles, and that is the continuation of the smooth circular muscles of the rectum. That is the continuation of the smooth circular muscles of the rectum. This is the, and that makes the internal anal sphincter. And the other anal sphincter, that is close to the skin surface, and then that is found above the internal anal sphincter, and it is skeletal, the muscles that make the external anal sphincter, that is of skeletal type, striated type, that is having the voluntary function also. We can squeeze our anus whenever we wants to, actually to not to permit the fetus and the flatus and the fecal matter not to go out. We can squeeze it. It is voluntary in control. This is the external anal sphincter. This is longitudinal muscles actually, and it has three parts: the superficial part of the external anal sphincter, and the subcutaneous part. This is the middle part, and the deep part of the external anal sphincter. And there are also groove, and that lies between the internal and external anal sphincter, and we call it the intersphincteric groove. And this also is very specific landmark, and especially the lower half of the anal canal and the part of the anal canal that is below this the level of the intersphincteric groove, that is also where the interior lining of the anal canal, they start to have keratinization. They have hair follicles, hairs, and they have pigmentation, and from where the skin of the perineum or the anal verge, and the the color and the texture of the skin, that that is same as that you would found in the skin of the anal verge. With the, how do you examine the anal canal? You can examine the anal canal with the digital rectal examination by putting your finger into the anal canal, and you assess and you feel the anything abnormal that is found in the anal canal. Or you can see, after just inspecting with the palpating with the help of just your finger, and you can insert an instrument, and we call it the proctoscope. Proctoscope is the instrument. With the help of such instrument, you can just visualize the anal canal. You can see whether there is a abnormal hemorrhoidal masses are there or not, and you can see any other thing, whether some tumor and some other thing that is coming out from the wall of the anal canal. You can see it with the help of the proctoscope. Proctoscope is a solid metallic this hollow cylindrical instrument that is passed through it, and it has an opening, and you and it has a probe inside it, and you can, after putting the proctoscope, you can actually put the proctoscope inside it, and you can just leave the this protruder actually, and you can assess or see with the help of the light source. Then you would visualize this anal canal, and you can visualize the anal canal with the help of endoscope also, such as the sigmoidoscope, and with the help of lower GI endoscopy you can visualize the anal canal. Pathology, the clinical aspect of the anal canal, that is the anal abscess. And anal abscess is caused by the infection of the anal glands, and the opening of the anal glands, actually they open in the valve of the anal canal, valve of the canal. The glands of the anal glands, actually the opening of the anal glands, they open into the valve, in the valve of the anal canals. Whenever this anal glands gets infected, it causes the anal abscess. Other is the fissure of the ano. What is the fissure in ano? Fissure in ano is actually vertical slit or cut or rupture of the internal lining of the anal canal, and we call it is a crack or just a fissure. It is a breach of the epithelial continuity in the anal canal in a vertical aspect, and we call it the fissure in ano. It is a very painful condition, and most of the time it heals without having any complication or sequelae. And another type of the pathology, that is the fistula in ano. Fistula in ano is a abnormal tract, and this tract is having two opening, and one opening actually that opens around the perianal skin, and the another opening of this tract actually that opens inside the anal canal, and the part that is above of the anal canal. And so the student, this is all about the anal canal. Thank you.